Okay, this is physical activity, cardiovascular exercise, and strength training. Cardiovascular exercise and strength training are two of the most crucial factors to a person's health. Cardiovascular exercise can look like running, swimming, biking, etc., which increases the heart rate and improves blood flow, heart efficiency, and lung capacity. Cardio is very beneficial to the body as it decreases risk of heart disease, burns calories, and boosts endurance. The guidelines for Americans suggest that at least 30 minutes a day on average is sufficient. On the other hand, strength training intends to maintain and build muscle mass. Strength training uses resistance such as weights, bands, or body weight. Strength training increases metabolism, builds muscle, and strengthens bones. The guidelines for Americans recommend at least 2 days a week of intense full body workout. Overall, cardiovascular exercise and strength training are necessary for all-around wellness. While cardio keeps the heart and lungs healthy, strength training builds muscles to protect joints and support and aid bodily movement.
So cardiorespiratory exercise refers to the ability of our heart, lungs, and circulatory system to work together to supply oxygen to our muscles while we're being active. Basically, it's the kind of exercise that keeps your heart rate up for several minutes at a time and helps build endurance. This type of exercise isn't short and intense, but it's done continuously and focuses on improving aerobic fitness. Because it engages the heart, lungs, and large muscle groups, it plays a key role in improving overall health and stamina. Some common examples of cardiorespiratory exercise include walking, running, cycling, and swimming. These activities all challenge your cardiovascular system while helping your body become more efficient at using oxygen.
Cardio is one of the simplest but most effective ways of improving overall health, both physically and mentally. It is especially beneficial for heart health. According to the Cleveland Clinic in a study done by Argawal in 2012, regular physical activity reduces major cardiovascular risk factors, including resting heart rate, obesity, high cholesterol, high blood pressure, metabolic syndrome, and diabetes. For people who already have heart conditions, exercise can improve their heart function and increase the amount of physical activity they can do without experiencing chest pain. Regular cardio has also been shown to decrease the chances of heart attacks and lower death rates in patients with coronary disease, which is one of the leading causes of death in the U.S., according to the American Heart Association. Cardio can support bone health by fighting issues like osteoporosis and can also improve your VO2 max, which is your body's ability to use oxygen more efficiently. For everyday wellness, it boosts your energy levels, helps you sleep better at night, and according to the Mayo Clinic, lowers overall stress, anxiety, and improvement in mood due to the release of endorphins.
Okay, next is strength training, which is also known as resistance training. This is identified as an exercise that helps build muscular strength and endurance by making muscles work against a force of resistance. A few examples of this are free weights like dumbbells, weight machines like a leg extension machine. There's also resistance bands, and then body weight like a plank. And the way that these exercises build muscle are as you lift the weight, you get tears in your muscle. And then over time, your body builds scar tissue over those muscles, which increases the hypertrophy in your muscles. And then we'll get more into it in the next slide, but it's also good for bone density. It can prevent injury and also increases your metabolism.
And like stated before, some health benefits of strength training are improved muscle mass and strength, improved bone density, which can prevent osteoporosis, and better joint health and mobility, weight management and metabolic health increase, and mental health improvement. And under mental health improvement, an article that studied mental health and the benefits of exercise in older adults stated that they felt that their mental health increased and their perception towards exercise led them from the pre-contemplation stage to the preparation and action stage of change.
So overall, cardio and strength are both important for your long-term wellness. Cardio is important for your heart, and strength training builds your muscles. According to Tan et al., 2023, combining these can have increased benefits such as reduced body fat percentage and as well as improved satisfaction with your exercise. And a common misconception is adding cardio to strength training hinders muscle growth, but that's not true. There are many ways to incorporate these into your weekly routine, and so I encourage you to do those. These are our references.